Are there any amendments? Ms. Trahan is recognized for 5 minutes. For what purpose does she?
Madam Chair, I have an amendment at the desk.
Clerk will report the amendment.
Amendment to H.R. 3887, offered by Ms. Trahan of Massachusetts. Strike page 3,
Without
lines.
objection, the reading of the amendment is dispensed with. The lady is recognized for 5 minutes to speak in support of her amendment.
Thank you, Madam Chairwoman. This amendment is straightforward. Instead of misrepresenting what gender-affirming care is while simultaneously attacking a group of vulnerable children and pediatric specialists, this proposal acknowledges the remarkable work being done at 59 children's hospitals across our country with teaching programs by doubling funding for the CHGME program. Currently, those 59 hospitals represent 1% of all hospitals in the country, but together, they train more than half of all pediatricians and pediatric specialists across our nation. Boston Children's Hospital in my home state is home to one of those training programs. In fact, the training program at Boston Children's receives no funding through Medicare and relies solely on CHGME to support their work with interns, residents, and fellows. Our children's hospitals have gone through almost more than they can bear after 3 years of responding to a triple-demic and a rapidly growing youth mental health crisis. Like so many hospitals, they've struggled to keep and recruit frontline healthcare workers. But unlike other healthcare facilities, children's hospitals are facing disproportionate levels of hate, harassment, and threats due to the embrace of rhetoric included in this legislation surrounding gender-affirming care. This vitriol, which is being exploited for political gain, only works to deter future healthcare professionals from entering the pediatric specialty for fear of violent threats and attacks. I want to remind my Republican colleagues of the kind of healthcare they are putting at risk while treating our pediatric workforce like they are pawns in a political game. Pediatric providers are training, learning, and making contributions to advance high quality and effective care that every single one of us would want for our own child if it was ever needed. The team at Boston Children's works around the clock to serve the children who travel from all over the country for specialized care. Esophageal atresia, or EA, is a birth defect that occurs when a baby is born without part of the esophagus. Until recently, there was no satisfactory treatment option for a child with long gap EA. Dr. John Foker personally trained the medical team at Boston Children's Hospital to perform his innovative and life-altering EA repair known as Foker process. Boston Children's surgeons have been working since 2009 to perfect this surgical technique, and children who receive this treatment in Boston show fewer hospitalization days, less time on ventilators, and more success eating. When we talk about prohibiting funds from going to our nation's children's hospital, we are talking about restricting access to this type of life-saving and life-improving care. This committee should be increasing access to health care for all children and supporting our pediatric workforce. By doubling funding for the CHGME program, my amendment does just that. Both Republicans and Democrats on this committee have had daunting conversations with our nation's children's hospitals, pleading for the resources they need to deliver care to our children. I strongly urge my colleagues to support my amendment so that we can answer those urgent requests for help, and I yield back the balance of my time.
Gentlelady yields back. Anyone seeking recognition to discuss it on the further discussion of the amendment? Anybody seeking a word?